Well, welcome everyone to today's community conversation about animal welfare, advocacy, and training. We're so glad to have you. I'm Emily Hobermail, the Director of Government Affairs with the Humane Rescue Alliance, here with our wonderful panel from the Physicians Committee for Responsible Medicine, DC Voters for Animals, and City Wildlife. We're so excited to talk to you about some of the wonderful legislative initiatives happening in our fair district as it relates to animal welfare and beyond. And so I will just give some brief housekeeping items. You are all going to be muted and off camera for the duration of the webinar, but you do have the option to talk to us via chat and answer and put in some questions in the Q&A. We will have time at the end for a little bit of Q&A, so please feel free, as you have questions that pop up, please go ahead and put them in there. We will get to them at the end. We're very happy again that you all are here and joining us today, and this is being recorded. We will send it out to everyone after the fact, along with some additional information about some of the actions that folks can take to be supportive and to make effort on all of these initiatives that we're talking about. So with that, I will turn it over to Max to say a little bit of a few words. So Max.
Thanks so much, Emily. Hey, everybody. My name is Max Broad. I'm the president of DC Voters for Animals. And what we're doing at DC VFA is working to lift up the DC policies and politicians doing the most for animals. I want to start by giving a shout out to Carrie Contini and Emily Hobermail, who came up with the idea for this event. The impetus for today's gathering came from a discussion around priority animal bills in DC Council. At the beginning of the year, we identified 3 bills that we wanted to see passed. One has already passed, and that's the Green Food Purchasing Act. That bill will reduce the carbon footprint of the food that DC government procures. The other 2 bills that we identified as priority bills, you'll hear about today: the Animal Care and Control Omnibus Act and the Healthy Hospitals Act. You'll also hear about a new initiative to protect birds from colliding with DC buildings, making just DC a more bird-friendly city. Unfortunately, one of our speakers, Chris Weiss from DC Environmental Network, was going to speak about an effort to address plastic waste to benefit DC wildlife and habitat, but won't be speaking today. He's dealing with the loss of a pet and had to take some personal time away from work. I'm sure many of us on the webinar can relate. If you know Chris and you'd like to assign an e-card that we put together for him, send me a message in a private message in the chat, and feel free to offer some love and condolences for him. So the idea of today's webinar is not just to inform, but to activate. We want to give you the tools to take action. We know everybody on this call cares about animals, but in order to make systemic change, we must act collectively. By taking action together, we can increase our impact. As they say, the whole is greater than the sum of its parts, and that's why we need you speaking up with your council members, kindly, steadfastly, nudging them forward on these issues that will save and change the lives of many of our friends of other species. So that's what we're here to do today. And I'm really excited for our 3 speakers. You're going to hear about some really fantastic animal initiatives. And so with that, I'm excited to turn it back to Emily. She's going to get us started with the first talk about the Animal Care and Control Omnibus Act. You already met Emily. And then afterwards, we'll hear from Jill Eckert from the Physicians Committee for Responsible Medicine, who's going to be speaking about the policy efforts on healthy hospital food in the District of Columbia. Jill's the Managing Director of Nutrition, and she's worked for 15 years to bring successful plant-based initiatives to schools, hospitals, and policymakers. She'll be speaking today about a pending bill that could dramatically change the food environment in hospitals across the district. And then we'll have Ann Lewis from City Wildlife. Ann's going to be talking. Ann is a retired architect and a licensed wildlife rehabilitator who's been involved in animal welfare issues for more than 25 years. In 2008, she and Jen Monsma founded City Wildlife with the goal of opening the District of Columbia's first wildlife rehabilitation center. Prior to founding City Wildlife, Ann served on the board of directors of the Washington Humane Society for 16 years and was WHS's president for 5 of those years. So like I said, we have 3 great speakers. Really excited for you to hear from all of them today. And with that, I'll turn it back to Emily for more on the Animal Care and Control Omnibus Act.
Great, thank you, Max. So I'm going to go ahead and share my screen here with a little bit of information about the Animal Care and Control Omnibus Act. And I will say that I was hoping to be joined today by my colleague, Chris Schindler, who's our Vice President of Field Services and is in charge of law enforcement for animal cruelty in the district. But unfortunately, he had a conflict and is not able to join us. If you do have any questions that are specific to law enforcement, please do go ahead and include them in the chat, and I will get those to Chris and we will get you some responses. So a little bit about the Animal Care and Control Omnibus Act. So this is legislation that was introduced in the last council cycle by Councilmember Mary Che and is pending reintroduction this legislative year. As I mentioned, HRA is the enforcement agency for animal cruelty laws in the district. And so we have a unique position to see firsthand where deficiencies in the law exist and to advocate for legislation that gives our humane law enforcement the tools they need to address systemic animal cruelty in our city. So this is an omnibus bill, which means that it has a lot of different aspects to it. And in this case, there are 7 important changes that relate to domestic animals and animal control operations that I'm just going to talk a little bit about. So some of the provisions include banning implements of dog fighting. There are a number of very specific tools that are used to train and facilitate dog fighting. And it is common for animal control officers for law enforcement to investigate a site of suspected dog fighting, only to find that the implements of dog fighting are present on the property, but the dogs themselves are not. The folks who engage in dog fighting are organized criminals. They're savvy of the laws, and they're often aware that if they keep the dogs separate from the place where the dogs are trained and the implements are found without the dogs, there are no dog fighting charges that can be levied against them. So this would close that loophole and give law enforcement the ability to press charges in the event that these implements of dog fighting are found in a location without the dogs that are being trained to fight. Another aspect of the legislation is authorizing lights for emergency vehicles. So this bill addresses the need for a faster response time in cases of life-threatening emergencies involving an animal by allowing the district's animal control vehicles to operate with emergency lights and sirens only when responding to life-threatening animal-related emergencies. So this could be an example is like a dangerous dog that is at large and is threatening to the community. This would give the ability for our animal control officers to respond in a timely manner and to be able to address that issue. In addition, there is the bonding for care of seized animals. So this provision will allow humane law enforcement to recover costs incurred when carrying and boarding seized animals during the pendency of criminal proceedings. Currently, whenever a seizure takes place to rescue abused or neglected animals, if the owner does not decide to forfeit the owner their ownership rights to the shelter, to Humane Rescue Alliance, then we have to hold on to those animals until the final adjudication of the criminal proceedings, which oftentimes takes many months, sometimes even years. There are dogs in our care, or animals in our care right now that have been in our facility for over a year. It's just a lack of fairness to those animals. They deserve the chance to go on and be adopted out to their next loving family, their next chance at a happy life. And this would expedite that process and also provide funding to care for those costs of caring for those animals while they are in the custody of the Humane Rescue Alliance, because they are still legally owned by the folks who are alleged of abusing them. And so having that funding provides for these animals that cannot be adopted out to be able to be maintained and cared for at the facility. The next point is a difficult topic, and I know it's not pleasant for anyone to hear about, and unfortunately, it is a reality of life. This is eliminating the loophole in sexual contact with animals. DC has the unfortunate distinction of being aligned with only 4 states that do not have an express prohibition on sexual contact between people and animals. So we need to close that loophole and pass an anti-sexual abuse law that pertains to animals. This legislation would also prohibit not only the sexual contact between a person and an animal, but also advertisement, offering of sale, or dissemination of photographs or video footage of that sexual contact between a person and an animal. And as I said, it is unfortunate, it's a horrible thing to talk about, but just last year we had 2 very horrible cases of animal sexual abuse that happened in the district. The photos here on this slide are one of the victims. Her name is Luna. The bottom right-hand photo is when she came to us. All of the injuries that she suffered included very severe damage to her pelvis, and she was really unable to walk without any form of without assistance. And the upper left-hand photo is her just recently running and playing on a beach. So happy news for her story. She is doing so well. We're so happy to see her recovery, but dogs like Luna deserve the justice that they have earned from the horrible abuse that they have suffered. And this needs to be completely prohibited in the district, as it is in almost every state. We also have a requirement for pet source to source rescued animals. So the bill would prohibit a pet store operator from selling common household pets like cats, dogs, rabbits, and aquatic turtles in a pet store unless the animal was obtained from a humane society, shelter, or rescue group. You may say aquatic turtles, that's a different one. We have heard of pet store sales bans related to dogs, cats, and even rabbits. There are many hundreds of jurisdictions that have passed similar legislation. There are a handful that have actually passed a prohibition on the sale of aquatic turtles as well. And part of the reason we're targeting that in the district is because it is a problem that our officers see all the time. It's very easy to obtain a pet aquatic turtle. You can buy one very inexpensively, $30 or less at a local pet store. And oftentimes that means that folks think that they are an easy pet that is easy to handle. And unfortunately don't realize that that comes with a 30-year lifespan, a commitment to proper care and maintenance. And so folks often will burn out on these animals, and we have 80 plus animals, 80 plus aquatic turtles surrendered to the shelter every year. And even worse than that are the number that are just released into the wild. Folks may think that this is a humane solution to dealing with an unwanted pet, but in the case of these turtles, they're primarily red-eared sliders, and they're actually quite an invasive species in the district. They compete with other wildlife for their habitat and for resources, and they're very good at thriving in our DC community, and that's to the detriment, unfortunately, of our native wildlife. So it's important to curtail that trade and to make safer habitats for these animals, for our native wildlife, as well as for turtles that are pet turtles. A new inclusion for the legislation this time around when it's reintroduced is the prohibition on cat declawing. So this is something that maybe folks are not as familiar with, but there's a growing trend across the country to pass the legislation prohibiting cat declawing. New York State just recently passed the first statewide prohibition on this practice. So this is an elective procedure that calls for the removal of the claw and the first bone of the toe, which is an amputation comparable to the removal of a human fingertip at the first knuckle. This is not just a nail trim, this is actually an amputation. It's a serious surgery that often comes with serious health risks and behavioral issues for the cats that have this procedure. So this legislation would prohibit the elective performance of declawing with exceptions for medical necessity when the cat has some sort of a cancer in their paw or something where there is actually a requirement for the health and safety of the cat that they have the procedure done. And the last component is managing pet ownership in a divorce. So family pets are currently treated as pure property. When a couple separates, divorces, terminates a domestic partnership, or has an annulment in the district. So this means that what is best for the pet is not taken into consideration. Usually it's just who has bought the pet or who has spent the most money on their care. That is what's taken into consideration. And unfortunately, in contentious separations, the ownership of a family pet can be used as a tool to hurt the other person, while not, again, taking into consideration what is truly best for the animal. So the bill modifies the pure property disposition of a pet in a divorce so that the court may assign sole or joint custody and ownership of a pet based upon the care and best interest of the animals. So it's a whole lot in the legislation. Of course, as I mentioned, I'm happy to answer any questions about any of the components, but we think it's all exciting and really good stuff. And I think it's important, again, that we're here talking about this legislation on the anniversary of Lady Bell's rescue, who is so important to all of us at HRA and has sort of become a mascot for us, because we hear so often, what can we do? What else can we do to support your efforts to help animals like Lady Bell and make sure that these things don't happen to animals in the district? So if you are interested in supporting the Animal Care and Control Omnibus Act, I'm going to talk a little bit about the status of the legislation and some ways that you can be helpful. So as I mentioned, this legislation was introduced in 2019. There are some changes to it this time around, which are currently with the council bill drafters. We were hoping that the bill may be dropped before the council went into their summer recess to finish out the budget. But unfortunately, just with all of the other priorities and things happening, we didn't quite make that mark. But the legislation is there with the drafters and is poised for reintroduction when the DC Council returns from their recess in September. So we are anticipating an introduction in September and hopefully a hearing following shortly thereafter. So the best, most helpful thing for you to do is to voice your support of the legislation to your ward and at-large DC council members, especially if they serve on the Judiciary and Public Safety Committee, which is where the legislation will be assigned. I've included the link here, which will take you to the DC Council website, as well as show on that page how you can find your individual DC Council representative who represents you. And I will include that in the follow-up too. It's a pretty easy website to remember. So some tips when you're having conversations with your elected officials, whether it be over the phone, via email, or in person, virtual meetings, is to be brief, specific, and courteous every time that you're talking with an elected official. Max said it well in his remarks. It's important to be polite and to be responsive when you're talking with your elected officials. People respond better when you have a friendly face and you're saying things in a respectful and polite way. So also helpful is learning some background about your legislators, find out how they voted on issues in the past. And DC Voters for Animal has a great score sheet that they have done in the last cycle to show some of the votes and how some of the council members came down on animal welfare issues. And so it's a good thing to kind of check out, see how your legislators have voted in the past, but also the other initiatives and things that are of interest to them. See if there are any things that you could tie in about the legislation you're passionate about with the work that they've done in other areas. Always be clear about the action you actually want your lawmaker to take. So we call that the ask. Make sure you always make the ask, include that you want them to be supportive and vote for the Animal Care and Control Omnibus Act. If they're on the Judiciary Committee, you encourage them to bring the bill up for a hearing as quickly as possible and to vote in favor of the legislation. Make sure you do make that direct request of what you want them to do. Give your own explanation as to why you care about the issue. It's important to have all the facts and all the information about why it's important, but speaking from your heart and explaining about why this issue concerns you, how it affects you, your family, your community, that often is something that legislators remember, and that it becomes ingrained in them so much more than any statistics or numbers that we could possibly provide. Also considering non-animal welfare arguments. So for example, with the animal sexual abuse legislation, it is well documented that animal sexual abuse is a predominant risk factor for interpersonal violence, particularly for child sexual abuse. So making some of these points and highlighting how this legislation and these issues impact people and the environment are helpful ways to get additional buy-in and really illustrate why this legislation is so important. So maybe it should be obvious, but stick to the facts, be truthful and honest. And I think where people get caught up with that is not necessarily when they're explaining the legislation, but maybe when they're asked some follow-up questions. It's okay to say that you're not an expert on the issue and that you need to go gather some more information to respond to any questions that people have. Don't guess. It's better to just say you're not sure, and you'll get back to them, and then reach out to me, and I will be happy to help you craft a response to whatever the question is. Being flexible is particularly important when it comes to actually meeting, even with virtual meetings. A lot of times folks are running a little bit late. These are people who have very busy schedules. Maybe you thought you were going to have a virtual meeting with your council member and it turns out it's with their chief of staff. All of this is just something you have to roll with, like water off a duck's back. You just really have to keep going and be flexible. Don't let it impact you or let it throw you off. Let your lawmaker know you live and vote in their ward, in their area, and remain in communication with their office. So attend hearings, provide supportive testimony. Don't let the one outreach that you do be the only thing that you do on this issue. So you can contact your elected officials with an email or phone call. Phone calls are usually better. Emails can sometimes tend to get lost. When you're making a phone call or an email, try to stick it to one topic. You can make a second email, make a second phone call about the other bills. It's just helpful for them to kind of keep the one issue and be specific and brief on that. And also remember to ask for a reply, particularly because with email and phone call, you're most likely going to be talking with staff. So they may not know their legislators' position on a given issue. So ask for a follow-up, ask to have a response about where they are thinking, what is going on. And again, it's a great opportunity to keep following up. It's also a great time to have a virtual meeting with your lawmaker's office. A lot of these offices have been very receptive to having meetings about animal welfare issues. So you can have, outreach to their office to schedule an appointment. Like I said, for the most part now, it will be virtual. When you have a meeting, make sure you start off with the thank you. Everybody loves to be thanked for something, even if it's just for their time. And make sure you provide background information, any kind of relevant handouts, either as follow-up with an email if it is a virtual meeting, or if it happens to be in person, something physical that you can hand them is good. It's important to listen as much as you talk. Maybe not 50-50 exactly as much as you talk, but give yourself time to hear any responses, questions, or concerns that your lawmakers or their office have, and make sure that you relay that to us. It will help inform how we approach the issue, any possible pitfalls that we're experiencing, or that just to know what the concerns are as we go forward with the legislation. It's important that this isn't seen as just a one-way line of communication, that it's a back and forth, a real conversation. And again, following up is so important. So take the time to send a thank you letter for their time, and also take that opportunity to reinforce some of the points you made, to send that follow-up information, that background information. And I've included here again, the link for the council offices that you can find your lawmaker, which will be sent to you after the fact. Just a handful of more ways you can support legislation. When there are calls to action from organizations, please do respond to them. There's a reason that we're asking you to take action at a particular time. Usually it's because there's a critical vote coming or a hearing coming up. So please do respond to those, make sure you're taking action. Attend community meetings and raise a question about legislation. It's a great time, again, to kind of get your voice out there, make yourself known as a constituent who lives in their ward, who is active in the legislative process and who cares about these issues, and making sure that you're sharing this information with your network, family, friends, coworkers. Make sure they're aware of this legislation, encourage them to get involved and share on social media. Letters to the editor are also a great opportunity to comment on legislation in a public setting. So you will have that opportunity to share the information with a wider audience, as well as get the attention of local lawmakers. And then actually voting is an important way to support legislation. It may seem a little strange to include that because, of course, how you vote is private, but whether you vote is publicly available information, and it behooves legislators to be aware of whether you vote or not, because if they perceive you as not being someone who votes or influences other voters, they often will not care as much about what you think, because you are not going to ultimately influence whether they get reelected or not. So voting is an important also civic duty in general, but a way that is important to advance legislation. So with that, there's my contact information, my email. So please feel free to get in touch with me if you have any more questions that we don't get to in the Q&A, or you just want to talk more and get involved in the legislation. And of course, I can say it enough times, I will include in the follow-up email to everyone's contact information from all the panelists. So you don't have to rush to write all this down. You'll be able to get to it later. So with that, I thank you, and I am going to turn it over to Jill to talk a little bit about healthy hospital food.
Great, I'm so glad to be here. Thank you so much, Max and Emily, for the invitation. Glad to be on the panel with you, Anne, as well. Let me share some slides and we'll jump right in. Okay, so I am here to talk about healthy food in hospitals, and as many of you may know and have made this connection, getting animals off our plate is such an important move for us as animal advocates. It's one of the fastest ways to kind of make such a big impact for our animal friends. So I'm delighted that I get to work on this issue and excited to talk to you about what we're up to. So who are we? In case you're not familiar, the Physicians Committee for Responsible Medicine. We're a nonprofit. We've been around for 35 years. I have a picture over here of our president, Dr. Neil Barnard, who founded us. We're based here in DC, and I happen to be coming in live from Northeast. We have 175,000 members all across the world, largely which are, dedicated animal advocates. And about, this number is a little bit old, but we have now 17,000 physicians, and we try to activate them in any way possible to be making a difference. Our goals are to just focus on changing the way doctors treat chronic diseases and empower them to get active and become advocates. And we also promote alternatives to the use of animals in medical education and research. And many other things. So what we're up to and why we're here focusing on hospital food is because hospitals have an important role to play. And we think it's an important teachable moment, and we don't want to leave this up to busy clinicians who are putting out fires all day. So with that idea that hospitalization can be this teachable moment, poor diets are a leading contributor to mortality in the United States and to most cardiovascular risk factors. And by providing education on dietary changes, hospitals really have this opportunity to create a healthy foundation as their patients are passing through. And food options provided to inpatient guests and staff should be a model for all to follow outside the hospital. So those are kind of our foundational thoughts as we get into building policy. And the American Medical Association has called for hospitals to take a stand in this space, for them to encourage healthy food options be available. And specifically, they call for providing plant-based meals and eliminating processed meats on the menus and providing and promoting healthful beverages. So the AMA is calling for this, and the World Health Organization has set us up to, for the processed meat part, they have issued a report in 2015 that every 50-gram portion of processed meat eaten daily increases colorectal cancer risk by 18%, which is a hot dog. You know, that's how much we're talking about here. So that's the evidence that the American Medical Association used to formulate their resolution. So we took that to Mary Che, Councilmember Mary Che, and put together a comprehensive Healthy Hospitals Amendment. And so this is, excuse me, I'm just going to change my view so I can see my slides a little bit better. All right. So hospitals shall do just what the AMA said. You make available to patients, staff, and visitors, so everybody in the hospital, a variety of healthful foods, including vegetarian and 100% plant-based meals. Goes on to kind of talk about what those meals could be made up of: low in saturated fat, sodium, added sugars, and ensuring that all patients, staff, and visitors are made aware of these options through appropriate menu listings, signage, and other means, which is such an important part of these policies that we're working on. So we don't just make these changes and don't tell anyone about it, or leave it up to the patient to have to, be recovering from a big surgery or some other issue and have to be an advocate while they're laying in the hospital bed, to make sure that these things are labeled and promoted. And then secondly, hospitals shall eliminate processed meats from all menus and provide and promote healthful beverages. So this was introduced similarly as Emily talked about her bill in 2019, and we're looking for a reintroduction in September. And so just for a little bit more background in terms of, kind of training you to kind of have these conversations with council members or friends and family or other people in positions of authority with hospitals, I wanted to give you a little bit more insight on why plant-based. Plant-based diet can prevent and reverse coronary heart disease, hypertension, high cholesterol, obesity, type 2 diabetes, a number of cancers, autoimmune diseases, and we're happy to share fact sheets, any information that would be helpful to help you feel more confident as you're having these conversations. Why are we really focused on plant-based specifically? And by saying that, we really mean 100%, so no animal products at all. So I just wanted to kind of quickly mention, there's a lot of health concerns with dairy products, and specifically, 30 to 50 million Americans are lactose intolerant. And we start thinking about our population in the district here, we know that up to 75% of African Americans and American Indians are lactose intolerant, and approximately 90% of Asian Americans are lactose intolerant. So it's important to be thinking about these offerings. And then processed meat, just you may be wondering, well, I kind of have an idea of what that is, but what exactly are processed meats? Bacon, hot dogs, sausages, deli meats, any meat that has been transformed through salting, curing, fermentation, smoking, or other processes to enhance flavor and improve preservation. So that's from the World Health Organization. And then, so just going back to the 50-gram portion that I mentioned, and what happens, there's the increase of colorectal cancer risk by 18%, just slightly over 19% for pancreatic cancer, death from heart disease by 24%, diabetes by 32%. So it's really risky, these particular, I mean, all animal products, we'd like to set them all aside, but in particular, the evidence is just scouring for these. So just continued information here. And colorectal cancer so closely linked to these processed meats. And colorectal cancer impacts 1.3 million people in the US, second leading cause of cancer death. And really just want to make sure that this slide communicates that we're seeing colorectal cancer incidence rising in young people. So 19% of cases are under age 55. And then if this is what I think is really the most important slide in terms of our real why DC, why are we focused on this, and why really focus on removing processed meat. If you look down here on the left to the District of Columbia, and we've got this broken down between incidence and mortality, you'll see that for incidence, non-Hispanic whites, 29.2 incidence, and then non-Hispanic Blacks, 61.7. When we go and you know, I can read over the results for women too, 27.8 non-Hispanic white, 44.6. When we go to mortality, look at these rates, 7.9 non-Hispanic white, 26.9 non-Hispanic Black. For women, it's 7.3 non-Hispanic white, 17.8 non-Hispanic Black. And so, you know, we're just seeing that, you know, colorectal cancer is disproportionately affecting people of color, incidence and mortality. So this is a very, very serious issue that we think hospitals really need to take steps to make changes. So what are we asking for? Just a little bit of review. We're asking for incorporating more plant-based options on inpatient menus and in the cafeteria for guests and staff. We're aiming for at least one full entree for breakfast, lunch, and dinner to eliminate all processed meats. And we think the Healthy Hospitals Amendment Act does a great job at covering this and really improving the environment. One of the concerns that shows up when we have conversations with DC hospitals, and we've met with every single one of them, and they don't rise to, you know, where we want them to be yet. But we went ahead and surveyed patients, like, what would you think if, you know, processed meats were removed? What would you think if you know, bacon and sausage were no longer on the menu? So we asked 200 patients in 2 DC hospitals, and they said being able to eat bacon or sausage was less than important, and by almost 70%. And then over 80% of participants strongly agreed, or were neutral about eliminating processed meats to reduce the risk of cancer. So when given the information, patients were on board. Now we just need to get the administrators and the clinicians who really should know this science to jump on board. So it's very similar kind of fight that we have with getting cigarettes out of hospitals. So I just wanted to kind of liken this campaign to that, and just pulled this quote here that is a physician saying, "I don't think I can deny a paying patient the right to smoke a cigarette. As a service to the patient, I will have to insist that we have a cigarette machine in the hospital." So these are some of the kind of strong ideas that we're facing here with processed meat. Just a few more notes. That we've had some great success passing mostly plant-based laws in California and New York. And this law in DC is way more comprehensive and stands to make a huge impact. And, you know, it's great to give hospitals good press, and they are definitely accustomed to getting bad press if they're called out for things. And just it's the right thing to do for your patients and staff. Just wanted to share that this has been done before. An Adventist hospital in California has a huge plant-based menu, and they've removed processed meat, and they're doing very well. So I just wanted to share their menu here with all these delicious options. And they walked through, I don't have too much time to go over this today, but I did just want to include this, that they have they worked with us on the removal of processed meats and their process. So we can work with hospitals on doing the same. And then there are a number of local hospitals and even hospitals in DC that have plant-based menus, plant-forward menus. Here's a few: Howard County General, Johns Hopkins. Sometimes you have to ask for them. Sometimes they're right on the main menu. But with this new bill, they would be front and center. And we have other ways to make life easy for hospital operations. We have a great set of recipes called Universal Meals, and with some delicious options. So we've got tons of resources to help people be champions in their own hospitals if they happen to work there or have a relationship with a hospital or know someone who does. Lots of recipes, fact sheets, and offering on-the-ground support for tastings and in-service trainings for clinicians and staff. It could be so important so that we don't just go in and make a ton of changes. You really create the foundation and the education and the buy-in early on by doing these educational programs. And then lastly, kind of my call to action is, have you had experience getting a plant-based meal or not getting a plant-based meal during a stay in DC hospital? Do you live in Ward 3? Would you be up for giving Councilmember Mary Cheh praise for reintroducing this bill this fall? Do you happen to live in Ward 7 or have a relationship with Councilmember Vince Gray, who chairs the Health Committee? That's going to be an important part of our process and our work this fall. Do you want to approach your local hospital to make changes? We could work with you on that. And then going back to talking about kind of the rising cancer rates, do you have experience with breast or colorectal cancer, which are cancers so strongly related to processed meat intake, and want to ensure that others aren't offered foods that could put them at risk for these diseases? Any of these things, we would love to hear from you, and I will certainly put my email, we'll have it in the follow-up email as well. So that's the end of my presentation. I'm so glad to be here, and I will look forward to the Q&A and passing it over to Ann next.
Thank you, Jill, so much. These are fantastic presentations, and I personally am enjoying them. And thank you, Max and Emily, for organizing this. It's a great opportunity to get together and show what's needed. I'm going to talk a little bit about why we should be concerned with bird-safe building legislation and what we can do about it. So there are two science studies that have come out within the last few years that highlight why we should care about the serious decline in bird populations in North America. This one came out in 2019, and the left-hand graph shows that we have lost nearly 3 billion birds in North America just since 1970. The middle graph shows each type of species of bird, and you'll see that they're all in some form of decline except for wetland birds, which is waterfowl. And those seem to be thriving because they do well in urban populations. The second study was done in 2015 and shows the anthropomorphic causes for decline of North American birds. In other words, we know that habitat loss is the primary decline, but these are the ones that humans can control. Cats, these are outdoor cats being the largest killer, but birds, windows or glass collisions are the second most, with up to 1 billion birds per year killed. So our program, Lights Out DC, involves about a couple dozen volunteers going out at 5:30 in the morning during migratory seasons and patrolling this small area of DC, picking up the carcasses of birds that have hit glass. And if the bird is still alive, which only 16% of them are, the volunteer takes them to our rehab center where we try to fix them up and release them. But the vast majority of these collisions are fatal. As you can see, it's a very small portion of DC, and blown up, this is our monitoring area from Union Station to the convention center. And you'll see that these little hatched buildings are the buildings we've found to be most problematic in those areas. At the end of the year, we catalog all the birds we've found for that year, and we photograph them, and then we donate their carcasses to the Smithsonian for research. This is just a part of the haul that we found in 2016, and every year these numbers are increasing. You can see the variety of different species. Some of our favorite birds, the little blue ones, are indigo buntings, are victims of these collisions. And I should say at this point that these collisions don't just take a bird toll, they take a human toll, because time and again, we've heard at our problem buildings of particular people who really hate going to work because during migratory seasons, because they think they might hear that thud against the glass that means a dead or injured bird. So there is a human component. Our data over the 10 years we've run this program shows that every year we're getting more and more birds. Last year we had found 665 birds just in our small area. The blue lines indicate the proportion of that total that those 5 buildings are responsible for. So what you can see here is that though the buildings themselves are not, the blue buildings are not contributing really more birds every year, as a proportion of the whole, that proportion is declining. And that's because in our monitoring area, so many new glass buildings have been built in the 10 years that we've been monitoring, particularly around Mount Vernon Square. And now, although we don't monitor the area down by the wharf and the Nat Stadium, they're just popping up all over and nobody is making them bird safe. So technically, why does this occur to the birds? First of all, they migrate at night and they're attracted to the night lights of our cities. So they come in and they're not familiar with our urban areas. They have poor depth perception because their eyes are on the side of their heads and they don't have good binocular vision. But most important, they don't see glass. It's as if glass is invisible. And the reason is, are the 2 qualities of glass. It's transparent and it's reflective. So looking at some of the studies that have been done, Chicago has a voluntary lights out program because they have a terrible bird collision problem. And this is a photo of how effective a voluntary program can be in Chicago. The top slide shows 11 p.m. during migratory seasons before the lights go out. And then when the voluntary program starts at 11 after the lights go out. And McCormick Place, which was one of the big bird killers in Chicago, showed that when they dimmed their lights, their bird collisions were reduced by 80%. So just dimming lights is effective. But then looking at the features of glass, this is one of our 5 buildings. It's the Tech World overpass that's across from the new Apple building near the convention center. And it needs no explanation about why this would be confusing to a bird in flight. This is what we consider a fly-through condition. That means that 2 sides of the building are transparent glass and birds simply think they can fly through this building. So this is the DC Court of Appeals and it's been responsible for 289 bird deaths in our period. And we just keep building them. Nobody is aware of this, or at least the players are not. If they're aware, they're not putting it in part of their program. This is a new building near the Georgetown Law Center at 250 Mass. And this is the plaza level between the new buildings. I should stress this building isn't even completed yet, and it's killed a couple dozen birds, and we're just finding them every time we monitor. So what you're looking at in the foreground is an ivy-covered ventilation core that I think ventilates the parking lot below, and is completely surrounded by glass. So any bird thinking it can land into the ivy hits the glass. And then in the background, that overpass is another fly-through condition that has 2 sides of transparent glass. And we found lots of birds below that, that overpass. So we need to do something about this program so that these buildings don't continue to kill birds, because birds don't learn. The birds coming through one season are not necessarily the same birds coming through another season. So the situation is not going to reverse itself over time. In fact, it'll get worse. So what makes a building bird safe? What do we want to stress? First of all, obviously a lights out program for the whole urban area would help. But there are also very finely studied now techniques and numerically measurable techniques to make glass visible to birds. Patterns on glass, architectural features, films, netting, and wind curtains, which are like parachute strings that are hung at 4 inches of intervals that kind of sway in the wind. Though we have one at City Wildlife, and it's a very beloved feature. People really get used to this, what's called a Zen Wind Curtain, and they're very, very cheap and very effective for birds. The top slide shows how little marking you need on the glass for the bird to see it as glass and a barrier. 2 inches vertically and 4 inches horizontally will kick out something like 90% of the bird collisions. And down below, the screen there shows techniques that might be put into a building for reasons other than bird safe. This is a solar screen to cut glare, and yet it is bird safe. So these measures don't need to add anything to the building cost. And at the very most, they might increase the cost of the glass itself somewhat, but not the overall percentage, the proportion of the building that the glass is going to be a small percentage. So the principles of bird safe design that I mentioned that are scientifically proven are available in a number of different guidelines, and it's too technical to go into, but the lead pilot credit at the bottom tends to be the most measurable standard that assigns a threat rating to each type of glass, and your building has to have a certain overall, it has to be lower than a certain overall threat rating to be considered bird safe. We're behind the 8 ball now in DC. There have been lots of bird safe legislative measures passed, and the American Bird Conservancy picks out 3 of them that they consider as recommended templates for other bird safe legislation. My highlights are in red just because these are the important features of them. One, they're all mandatory. Many of the bird safe initiatives are voluntary, and if nobody volunteers to do them, they're obviously ineffective. And the second feature of these pieces of legislation is how comprehensive they are in terms of buildings that are covered. So Mountain View, California, and New York City are covering all new buildings. And I should stress that the New York City law that was passed in 2019 has broken all conventions for what can be passed and what should be passed. It's a model law and extraordinarily comprehensive. And if we can do this in DC with letting New York lead the way, it would be extraordinary. All new buildings are covered, even houses. This is a very strict law. Toronto's law, they led the way years ago. They've had a mandatory guideline for industrial and all buildings, but we need to use these as our basis for legislation. Then other bird safe legislation that's been passed in various levels of effectiveness and detail are all of these. At the very bottom, notice that both the federal government and the state of Maryland have pending bird safe legislations. In both cases, that legislation would cover government buildings. The federal bill that I think has not been reintroduced, but was introduced last year and has passed the House, would require all GSA buildings to be bird safe. And the Maryland law similarly requires all Maryland government buildings to be bird safe. So those will be groundbreaking if they pass. You'll also notice that at the end of the top list, Washington, DC is listed. We do have an initiative, and our initiative is buried in the Green Construction Code and follows the lead measurement tool. But it's a voluntary credit and not all buildings are subject to the Green Construction Code in DC. So it could be strengthened somewhat. So lastly, what can you do to help us? What are the action items? We don't have legislation yet, although Councilmember Che is supportive of this legislation. So we need to draft legislation that we think is appropriate to DC and can be passed. And City Wildlife has already started that process, but we could use any help we can get if anyone has any experience in legislation. And then in terms of our Lights Out program, if you know of a building that's killing birds in DC, please let us know where it is, because often we can assign a single volunteer to a single building. You don't have to get up at 5:30 in the morning and look at 20 buildings because these birds do hit all during the day. You can do what I'm doing now, which is give presentations to groups. I always tell our volunteers that one person is a group. So even if you talk about this at your cocktail party, you're educating somebody, and there's a multiplier effect with that. And then when we introduce legislation, then we can go back into Emily's process of what you can do to support it. But at the moment, we're still developing the legislation. And then probably most important is spread the word, because even among architects, it's surprising how few people are aware of this threat. And we're here to help you. These are, Lizbeth is the coordinator of Lights Out, and I'm the president, and we're here to help you in any way we can. So thank you. And I guess we can open it to questions, Emily.
Yep, that sounds great. So thank you, Anne. Thank you, Jill. Those were so informative, such great presentations. I think we probably have time for a couple of questions. Before we do, if people want to put any of their questions in the chat right now, I want to give Max an opportunity to talk about briefly another opportunity to learn more about some legislative action in the district.
Yeah, hey all, just a quick upcoming event while you put your questions in the chat. For those of you familiar with the fur industry and where fur comes from, you probably know that it's incredibly cruel, whether it's animals in factory farms who are kept and killed in just the worst conditions, or animals who are trapped in the wild and left in their traps for hours or days on end. So what we're doing on August 3rd is hearing from some campaigners who passed a fur ban in Berkeley to hear their best practices, tips, pro tips, lessons learned. So if you want to join for that, I will put a link in the chat.
Okay, well, let's get right on into the Q&A in the couple minutes that we have left. Lauren, did you want to?
Yes, so there are a few questions coming in. First, Emily, for you is why wasn't the bill passed in 2019? And are there other about read the sale of in pet stores? Does that include other small mammals as well?
Yeah, so the legislation was introduced in 2019, though we didn't really expect any action on it until 2020. And then 2020 was 2020. I think we all had a very unexpected year. There were a lot of priorities that the DC Council had to manage related to the pandemic, and they just didn't get to us. It had nothing to do with legislators having animosity or issues with the legislation. We just really ran out of time. The legislative cycle lasts for 2 years, so the legislation that's introduced this year will have until the end of 2022 to pass. Related to the species included in the pet store legislation, we are still talking to Councilmember Che about the final list of species. Right now, we have settled on the cats, dogs, rabbits, and turtles, but there's the possibility to add additional animals to that list. The ones included are ones that have either had significant progress in other states and other precedent for that action, or like in the case of the turtles, something that we see as a particular need in DC. But I think it's worth the conversation about what all may be included in that.
Great, thank you. And just for time's sake, I believe the other ones I can direct to the panelists to answer directly. So I will do that. So just to be mindful of everyone's time. I believe that is all we have.
All right, well, that sounds good. We're right at 1 o'clock. So thank you all for joining us, for staying and hearing the whole presentation and learning about all these exciting initiatives. As I mentioned, I will send a follow-up email to everyone who registered with the action items, fact sheets, additional information, and contact information for all of the panelists and all of the groups. And we so appreciate you all being here with us and wanting to be these effective advocates for animals in the district. So thank you all and have a good rest of your day.